Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Hello, everybody. Dr. Habib here, and I'm here with JP. How are you, sir?
I'm doing really well, thanks.
This episode of the Health Upgrade Podcast is brought to you by Truvaga. Have you been looking for a simple way to feel calmer, think clearer, and sleep better? Imagine achieving this with just 2 minutes a day. I'm excited to introduce you to Truvaga, a handheld device that supports your nervous system through gentle vagus nerve stimulation. As a doctor specializing in functional health and wellness, I've seen firsthand how Truvaga has accelerated healing in my clients. I've used this device to help people with a range of issues, from sleep disturbances and heart palpitations to digestive dysfunction, nervous system imbalances, and mental wellness concerns. The results have honestly been remarkable. Truvaga is designed to catalyze and accelerate the shift in your body from fight or flight to rest, digest, and recover mode, helping you manage stress, maintain mental clarity, and unwind more easily. It's not just theory. I've witnessed its positive impact on real people facing real health challenges. The best part? Truvaga fits seamlessly into your routine. No need to carve out hours for wellness. Just 2 minutes a day can make a difference. It's a small investment of time for potentially significant benefits in how you feel and function each day. If you're curious to experience Truvaga for yourself, visit truvaga.com/upgrade. You can save $30 on your device by using the code UPGRADE30 at checkout. Remember, that's truvaga.com, truvaga.com/upgrade. It might just be the first step towards a calmer, clearer you, just as it has been for many of my clients.
Today, we want to dig into a topic that is focused around a particular condition that is quite alarming, quite challenging for a lot of people that are experiencing it, and that is mast cell activation syndrome. And we'll get into the full diagnosis and understanding the symptoms and signs and symptoms and what people are looking for when they're, from a medical side, looking at, is this potentially the thing that this person is dealing with? But before we do that, we should probably take a step back and really understand the root of this to talk about what a mast cell is, how they function, what their role is within the body, and what would cause us to lean into a full-on activation of these particular immune cells into a syndrome type of situation. All right. So, JP, why don't we jump in on initially chatting about this concept of a mast cell? What is a mast cell?
Sure. Mast cells are immune cells. And we've talked a lot on this program about tissue-resident macrophages. Mast cells are related to macrophages in that they're not macrophages, but they do a lot of similar things, and they tend to work hand in hand with macrophages. We have mast cells throughout our body, typically in endothelial tissue and connective tissue, but they can really be anywhere. And one of their primary roles is to sort of activate and signal the rest of the immune system that there's a problem and that it needs to be activated and become involved in dealing with either a pathogen or, it could be an injury, it could be a sensitization issue, some pollen or some allergen that comes into contact with the tissue that needs to be dealt with. And so one of the defining features of mast cells is this ability to what they call degranulate. It has in it these little granules, if you will. They're not literally hard little granules, but they contain cytokines and other signaling molecules and other things that are part of the inflammatory process, helping to cause swelling, cause edema, cause an influx of other immune cells into the tissue. And so having them function is really important for your immune system. Having them dysfunctional is in some ways a lot like an allergic reaction, because you're having these cells sending signals that the immune system has to be activated when maybe that's not the right thing to have that going on.
Yeah, if we dig a little bit into what these mast cells are, there's 3 general types of mast cells that we can understand. And we understand that they're called mast cells because they have these granules that when we look at the slides that show these particular cells and we put different types of, it's almost like coloring them, but they're dyes to make sure that you can separate and see the different things that are present at the cellular level. There's 3 different shades that will pop up. There's an eosinophil, a basophil, and a neutrophil. These are the 3 types of mast cells that are generally noticed on these histological slides. And so what we're looking at is eosinophils generally will color in this eosin style color. Basophils are a much darker basophilic color. And then the neutrophils don't allow either of the eosinophilic or basophilic dye to activate it. And so the colors will be a little different. And that's how you can tell whether you're looking at an eosinophil, a basophil, or a neutrophil. And they have slightly different, very similar functionality, but slightly different in that eosinophils tend to look a little bit more for parasites, things like worms, things like amoeba parasites, things like blastocystis hominis, things like Dientamoeba fragilis. These are the amoebas, or more on the Pentatrichomonas hominis and these well-known parasite worms that are present in a lot of people. So eosinophils are a little bit more leaning towards the parasites. Basophils lean a little bit more towards viruses and bacteria a little bit more. And neutrophils are kind of a wide ranging, they'll affect all of them above.
And just to dive a little bit more into that, when people have some sort of growth on their body, I'm not talking about like a cancerous growth, but maybe you're not sure, and you want to go in and you want to get a biopsy done of that tissue. One of the things that you may see on the lab report is, okay, in that swollen tissue that had you worried, they'll tell you what type of infiltrate there is, whether it's eosinophilic, neutrophilic, which type of mast cell is present in that tissue. And that helps tell you what may have caused that. It helps because, as you said, they tend to be associated with certain types of pathogens. So just a little background. So for people who might have say, hey, I recognize that, I've seen that on a lab report, that's what they were looking for.
Because you mentioned the lab report, I do want to bring this up. Everybody has been tested for these on your complete blood count, your CBC that shows up, that basic blood work that everybody gets and nobody really knows how to read it. There's a section there that talks about the white blood cells, WBC count, and then right below it has neutrophils, lymphocytes, basophils, eosinophils, and those are listed, and those are the names of those mast cells. And there's a little range that goes beside, and then you want to see where you are in that range, and that's how you know whether you're in an immune response or not. And I'm going to just give you a little bit of a clinical perspective here, but I actually find that the numbers, the ranges that are there are too wide. I don't think that a normal range for an eosinophil, for example, should be between 0 and 0.5. I actually think 0.3, 0.4, we're seeing activation. We're seeing something has actually occurred. So specifically in this particular sense, if you see over 0.2, and that's something that I look for when I'm looking at my client's blood work, and I see eosinophils are a little bit leaning towards that higher side, we're not just looking for the flag that something is high. We're looking deeper to understand, are we in that optimal zone, or is something leaning or pushing us a slight askew out of that optimal range? And that's the way a functional medicine practitioner would look at your blood work.
And that's really true of all the ranges that are provided. The ranges are not the optimal ranges. What that is the normal range. And just to understand the difference, and I like this analogy because, well, I experienced it and I thought it was crazy. I studied for the bar exam because I'm a lawyer also. And when I studied for the bar exam, there's 2 parts. There's an essay section and then there's a multiple choice section. In the multiple choice section, it's, you got to write down A, B, C, D, or E. It turns out that the way the bar exam is graded, even though there is a right answer, if 80% of the people taking the test all write down the same wrong answer, they give everybody credit. And the reason is because they feel like, well, they must have miswritten the question. If 80% of the people got the same wrong answer, they're going to just accept that as a true answer. It's kind of the same thing with your lab work. If everybody has eosinophils between 0.4 and 0.5, they're going to write down the normal range between 0.4 and 0.5. Even if we know that the healthier range is down at 0 to 0.1. So remember, normal range doesn't mean healthy range.
Exactly. There's a big disconnect here. Normal and common and optimal are three very different things, right? We want to ideally drive towards optimal. That's the whole idea of Health Upgraded, and the Health Upgrade podcast is we want to optimize. We want to work towards getting our ranges, those numbers, as close to optimal as possible. So let's dig into the process by which degranulation within these mast cells occurs. Okay. We don't need to get into the nitty gritty of the looking at a specific cell, but you mentioned the granules, and each of these cells has these granules that are located, they're almost looking like little dots within a pocket that's present within these cells. Okay. And based on the color, we then can identify whether it's a basophil, eosinophil, or neutrophil. And when there is an activation that occurs, when there is a presence of some sort of pathogenic threat to our survival, something that should not be present, injury is absolutely going to be a driver as well. But anything that is a traumatic input to that area, the immune cells are going to become activated. And this is that first step in the activation of all immune cells. They're all going to push towards a threat response state immediately. That's the first step that's going to occur. Mast cells are going to begin to degranulate. They're going to start to send out these granules that contain histamines. Histamines are the single major driver of the style of response that is going to take place within your body. So a histamine style reaction, you mentioned earlier, JP, is almost this symptomatic nature of an allergy. Okay, it's going to drive swelling. It's going to drive an allergic style response. It's also going to drive upregulation and release of IgE specific antibodies. So there's different types of antibodies that will come out. IgE is the primary antibody that occurs or that is released in an allergic style response, and histamines are the primary driver of initiating that process to take place. So we degranulate. These little granules will pop out. They'll go out into the extracellular matrix, the space between these cells. They'll start to pop and attach to the threat, whether it's a physical injury because there's swelling, there's blood flow that's infiltrating, or whether there's some sort of bacteria, virus, parasite, something that's present that should not be. They'll start to attach, and that will attract more and more immune cell activation in that area, creating the swelling. So the same way that somebody gets a bump on their arm and we get this bruise and swelling that will occur, that is an infiltration. It's calling all of the immune cells locally to this area to say, we need to stop this threat to our survival. And we become activated in that way. Mast cells do so when there is a threat that tends to be slightly skewed towards either something that we're allergic to or bacteria, parasites, viruses, yeast, and worms. So that's the primary area that will allow that to occur.
Yeah, and it's bidirectional. We say that they become active because you've encountered something that you're allergic to or that has some activation of your immune system that you're sensitized to. But what you're sensitized to is also a function of whether or not those mast cells are behaving that way. So it's not always that the mast cells are just reacting normally, and when you encounter something that should cause a reaction, you get the reaction. Sometimes things that shouldn't cause the reaction cause a reaction because the mast cells are not functioning properly.
And what drives that to occur, there's a few different things, but that's basically called priming, right? They're pushed into a primed state, ready to respond almost inappropriately, right? Or just too activated.
You've become sensitized. Think about it that way. Think about it like, if your kid has done the same thing over and over and over again to bother you, and you've been patient and you've been patient and you've been patient, the next time I love it when my kids, why are you yelling? Because I said the same thing 6 times in a row with a calm, cool, collected voice, patient, but you didn't listen. So I became primed, okay? I became primed like a mast cell that has become activated and was waiting to pounce.
That analogy hits harder than you realize right now.
It's a little different when you got a couple of kids like that. So,
absolutely. So yeah, that's exactly right. Every immune cell has this priming activation that does occur, right? And there are a few things that will prime your immune cells to become more ready to explode or ready to react and activate in that particular sense. There are a couple of genetic components that can drive this. They're not usually the driving force, but there are some associations on the genetic side. But generally, genetics will play between 10 and 30% of the role here. We're not looking at them as the primary driver, but yeah, go for it.
Well, what I would say is that is true, that there's idiopathic reasons why, or other priming factors that can cause it, toxins and other things that we'll talk about. But in situations where you do have a genetic problem, for example, we've talked about this a little off camera beforehand, Ehlers-Danlos syndrome, which is, in the UK or other places, they call it joint hypermobility syndrome. When you have that problem with collagen, which is a genetic disorder in the development and the growth and the formation of collagen fibers and molecules, that is associated with mast cell activation problems, because mast cells tend to aggregate and sort of collect and be in connective tissue. So when they sense that connective tissue isn't constructed properly, they know that there's potentially a risk here, and damage is, maybe more likely or more damaging, or pathogen could be more risky in that environment. And so they're primed. They're sitting, waiting to explode, if you will. And that's probably a better than average analogy, because they actually do sort of explode with all of their granules.
Degranulation looks very much from what we can imagine as an explosion of that cell to release these histamines and the granules out. What's unique about the mast cell specific process, separate from the other immune cells, is that it's a combination of inflammation plus allergy that you're experiencing, right? That's a combination of an inflamed response, the same way that a macrophage or a lymphocyte would react to inflammation, but it's also adding in this allergy response, the IgE style, histamine style activation that is occurring.
And there's also a component of the autonomic nervous system in this process, where you can have, a mast cell activation that occurs. For example, there's forms of asthma that come not from pollen or from an allergen, but literally just from a stress, like exercise-induced asthma or just stress-induced asthma. People who start wheezing when they get anxious, when they get anxiety-ridden. I'm sure there's a feedback mechanism that kicks in there as well. But those are mast cells being activated.
Yeah, that is the driver pushing towards that sympathetic state. So as soon as we have this drive of even something that seems trivial, that pushes somebody into a sympathetic state, if they're primed to be in that state, or those mast cells are particularly primed to turn on, that histamine reaction will turn on and we'll get this particular reaction or the symptomatic response, such as asthma. And so this is something that I've personally experienced. I used to have, or used to suffer from, exercise-induced asthma. Just going for a short run and I would be wheezing like crazy. I can bike now and not have an issue, but I've been able to figure out why that was occurring. We'll talk a little bit about that. So this is a very, very common reaction, and something that people need to look for. If they're noticing that something stressful is triggering what feels like an allergic response, but they're trying to figure out if there's an allergy or some biochemical trigger that's causing this, maybe it's that your autonomic nervous system has been pushed and primed into a sympathetic state, or that you're leaning heavily into that sympathetic activation state. And what's essentially occurring is we're not getting as much control over these immune cells. And that's really the job of the autonomic nervous system, in my opinion, when it comes to the neuroimmune connection, how the brain, the nervous system connects to the immune cells present within every cell of the body, is that when we are driven more into a sympathetic state, we prime these immune cells to become ready to activate on a moment's notice, or push into a state where it's capable of doing so far more readily. Whereas on the opposite side of this, where the vagus nerve lives in the parasympathetic control, where the cholinergic component comes in, where acetylcholine activates the calming and resolution effect and recovery effect in these immune cells, that's going to drive those cells to not have to degranulate as readily. And so it decreases the priming that is ready to occur. In the same way we've talked about this 1,000 times on the podcast, macrophages shift into an M1 activated, ready to go state. That's the priming effect of the sympathetic nervous system that drives that process in all immune cells, mast cells or otherwise. M2 is very much this calm, recovery based, regulated immune state that's present in these immune cells. And that is driven primarily through parasympathetic signaling, acetylcholine release, and acetylcholine attaching to that same receptor. By the way, mast cells and macrophages have the same receptor on them, that same alpha 7 nicotinic acetylcholine receptor. So when we are activated, when we're put into that parasympathetic state, when we do our deep breathing exercises, humming, chanting, gargling, singing, vagus nerve activation tools that help to calm us down, we push those immune cells, or we send signals to de-prime them, or to take them out of that primed, ready to react state. And so they're not hyper-reactive anymore. And that's really where the autonomic nervous system sits. Anything you want to add there?
I just think it might be a good idea just to back up a little bit, because one of the things you said at the beginning, or that I was thinking about when you were talking at the very beginning about this, is, mast cell activation syndrome is, or at least was up until maybe about a decade ago, pretty controversial. People didn't believe it. I think now, with our understanding of the immune system sort of evolving more rapidly, there's a general acceptance of the fact that, yes, this is a phenomenon that occurs. But I don't think there's a clear understanding in the general population as to what the symptoms are and what you need to recognize in yourself that is this primed state that your mast cells may be existing in that is leading to some symptoms that are suboptimal. So, and as a result, I think it's probably far more common than is generally believed or generally considered. I think it's more prevalent. Much the same way I think that joint hypermobility syndrome or Ehlers-Danlos is more common than most people recognize. I think there's a lot more people who suffer with it than are truly diagnosed. And I think that it probably would explain a lot of chronic conditions that are being experienced but not maybe properly treated. So maybe it would be a good idea just for the audience, just to some people might be saying, well, what should I be looking for? I've got some of these things, but what am I looking for?
The main symptoms of a mast cell activation, maybe not the syndrome necessarily, but definitely leaning in that direction, we're going to start seeing, or at least from a history perspective, when I'm speaking to my clients, is I hear that they've been sick for a very long time. They've been dealing with some sort of allergy, food sensitivity, getting sick quite often. These are very common things because it's been leading in this direction for a long, long, long time. They don't heal wounds very well. This is very much linked to that Ehlers-Danlos syndrome style reaction. They may have, as a child, had eczema. Presence of skin tags, cherry angiomas are very, very common in these reactions. But the big one that you're looking for, by far, is hyperreactivity to foods. Food hyperactivation is like a major, major driver here. I want to share a story of one of my clients that is dealing with something here, and we can dig into this a little bit more. But this client came to see me in February of this year, 2025, and was telling me that her meals, she had literally come down to 3 foods that she was capable of eating. And this is like a very, very unfortunate circumstance that she had gotten into this particular situation. She was literally down to eating sweet potatoes, carrots, and chicken breast. Those were the 3 things that her body was capable of handling without having extreme reaction. She was still reacting to food. She still had some histamine style reactions. She was having headaches. She was having significant brain fog for a couple hours after her meal, had to lay down, had to give her body, like, actively try to create an opportunity for digestion to take place in a parasympathetic state. She was incapable of doing that generally. It took for her to eat that meal, literally, and she was only eating 2 meals daily. It took her an hour and a half to complete the meal because she was reacting while she was eating. This was just so severe. So this is a very common, unfortunately, story that I do hear from a lot of people. And I'll kind of lean it over to you to share some more.
Yeah, I was going to say that's obviously a very extreme case. but it certainly does highlight a lot of the different problems. My earliest involvement in the healthcare field was in orthopedics and in the spine field. And one of the things, I think I've mentioned it on the pod before, that was sort of just an observation that was made by some physicians, older physicians who were passing this information down, was that the speed with which somebody healed from a spine surgery and how well they responded to the spine surgery was predictable. And the very simple test that they did was they would scrape a fingernail across the back of a person who was going to have the surgery. And for most people, there's no mark left. It's just a fingernail scratch. But for a small percentage of the population, but it would be 5-10%, you would see this large raised red welt that would arise out of the skin as a result of just a fingernail being run across the skin. And those patients didn't heal well. And when you put together the pieces, you start to realize that that's an immune system that is not in a rest, digest, and heal state, or doesn't easily get into that state, and is as a result going to have a difficult time healing from surgery. And so when I think about the fact that that's demonstrating that your mast cells that are in the skin are reacting to something in a hyper-responsive way, a hypersensitized way. So,
even going a little bit narrow or a little bit more generic and sharing that I've seen this actively quite commonly around me. We go camping, no big deal. Mosquitoes are everywhere. Where we go camping, you get a mosquito bite. Well, if you ever notice that mosquito bite is more than a small little round red circle, it becomes hyperactivated. The skin around it becomes quite red, very, very swollen, sensitive to touch. This is a sign that skin has been activated into the sympathetic, hyperactivated, mast cell activated state. And so we're heavily leaning in that direction. If you notice that something as simple as a small mosquito bite can trigger that, that is telling you that your immune system is acting almost inappropriately to the stressor that has occurred.
Yep. And, just even not to the extent of like a Raynaud's response, but splotchy skin, where just, wiping a rag across, your skin will cause a big red welt to appear. That's a sign that you might not be symptomatic otherwise, but you have an immune system that's probably elevated. And if we were to do a blood test on you, chances are we would find that your mast cell, your various different granulocytes are elevated, and probably at the higher end, might still be in the normal range, but would be elevated compared to the ideal range, the upgraded range.
Exactly. So the question really comes down to, in a situation like this, like the situation that my client was in, what causes these mast cells to become primed or pushed into this state? You've mentioned the autonomic nervous system, something that we talk a lot about. There is a very strong autonomic component in priming when we are in this sympathetic state chronically, or we're pushed chronically towards sympathetic state. Now, I want people to understand that the sympathetic parasympathetic balance is not like a light switch that just goes on and off. It is very much a dimmer switch. Okay. And we're constantly kind of going back and forth to the extent that our breath, when we inhale, drives a slight sympathetic activation. When we exhale, drives a slight parasympathetic activation. And so it pushes into kind of the lower, dimmer light and then a slightly higher light. But if your dimmer switch is leaning slightly higher, that can be enough to prime and push these cells into that state. So we have to ask the question, what could drive this to occur in these patients, in these people that are experiencing extreme hypersensitivity to stressors? The answers are the bucket is full, right? That bucket analogy of what has accumulated stress-wise over their life that's caused the bucket to get as close to full as possible, such that a small drop of water or just adding a little bit of extra fluid into that bucket is going to cause that bucket to overflow. One of the big things that comes up here that I don't think is looked at enough in the medical system currently is childhood adverse events, adverse childhood events, ACEs. No question about it. This is a major, major driver, a major trigger that primes the nervous system to not know how to regulate, to not know how to drive towards parasympathetic. And what that does is it activates the sympathetic state. Some kids that are hypersensitive to sound, hypersensitive to things experienced around them, right? The garbage truck is coming by. Oh my goodness, what is that? Or the lightning that's flashing during the thunderstorm. And they're just getting so hyperactivated. They're so afraid of what could happen. It's a complete lack of this feeling of safety, physical, emotional safety that this person has experienced through some sort of adverse childhood trauma or event that may have occurred in the past. In addition, physical and biochemical stressors.
Yeah, I was just going to say, I remember the thing that we talk about a lot is the fact that the immune system doesn't respond differently from a physical injury or physical threat or an emotional threat or even, lack of sleep or some environmental stress. All of it is activating a threat response because, yes, we differentiate between things that you think about versus things that you do. But that's because we just happen to be that far evolved. But our immune systems were evolved long before we got to the point where we could think about what we were going to have for dinner, and pull it out of the refrigerator. That response is hardwired in as any kind of lack of safety, any kind of threat. And so if you have adverse child experiences that lead you to be unable to get out of that threat response mode, or you find yourself very easily pushed into that threat response mode, well, then you're going to end up with an immune system that's basically hypervigilant. And that hypervigilance is what we're talking about here with mast cell priming.
Yeah, hypervigilance, I think, is a perfect word here. And it's specifically the mast cells and the immune system overall that's going to hyperactivate or hyperreact because they're just sitting vigilant, ready to go all the time, almost too much. And it's other stressors as well. We also have to really look at dysbiosis. Dysbiosis is the bacterial or overall population of what's living in your gut specifically, but also external to your body, oral,
skin, airway,
gut microbiome are all going to play a major role here. We talked about the fact that mast cells are primarily found in epithelial, endothelial, and mucosal tissues, right? So they're sitting in the skin, which is kind of the epithelial tissues. They're sitting in the mucosal tissues, which is the lining of the gut, the mouth, the nose, the airways, the lungs, right? So these are huge. And then the endothelial is the lining of the blood vessels. So these mast cells are sitting there making sure that these areas that are generally a little bit more vulnerable, because this is the barrier to our body, they're sitting there making sure that these barriers are not breached. And those areas can be hyperactivated. When it comes to the microbiome, something we've talked a lot about, microbiome activation, microbiome specific triggers, right? Dysbiosis. This is a good bacterial population that's been shifted by opportunistic dysbiotic bacteria. These are bacteria, parasites, viruses, yeast, worms, things that should not necessarily be there, that are hyperactivating, that are hyper triggering, and essentially sending the signal to these immune cells, these mast cells in particular, to become hypervigilant again. So not only are we having this neurological drive towards sympathetic state because somebody's gone through adverse events and we're filling up that bucket a little bit, but then we're adding in dysbiotic bacterial population because the diet hasn't been on point for a very long time. And there's a bit more sugar and a little bit more processed food that should be coming in that's driving the dysbiosis and allowing the gut lining to become leaky and allowing the toxins to enter and trigger the immune cells. 70% of our immune cells total within the body by volume are located in the lining of the gut. That's the primary spot. So gut dysbiosis is a major trigger that needs to be looked at, needs to be addressed. The foods that you eat, this is exactly why my client and a lot of people that deal with MCAS, mast cell activation, are dealing with intolerance to certain foods, right? They're unable to trigger or unable to regulate their immune cells during this food intake. I think that's a huge piece to the puzzle that functional medicine does do really well is testing to see what's going on with the gut bacterial population, what's going on with the gut lining, understanding that that is really where the regulation of the gut needs to take place. And then in addition, this is where you and I are trying to do a lot of work here, is to help initiate this neurological regulation, this self-regulation of being able to shift your autonomic state from sympathetic to parasympathetic, and to enable that signaling to those immune cells to down regulate, to not be as vigilant, to not be primed all the time.
Well, I know the gut is very, very important, but there's a tremendous amount of the immune system that's also in the skin and in your airways. And those are the three places where they're interfacing with the outside world. And so it's very important. And it's also, critically important to just the overall intuition about this is to recognize that what are the other symptoms? We've talked about, allergic responses to food that are triggering this, or insensitivities to food, but it's also asthma-like airway, allergic rhinitis, chronic sinusitis, asthma, all of these conditions are being triggered by hyper-responsive mast cells, hyper-responsive immune reactions to otherwise what should be normal. But because we're hypersensitized to it, we're reacting. Same thing with eczema and other, atopic dermatitis and other things. You're again creating an environment where the natural and normal skin microbiome is either dysbiotic, or your response to a normal microbiome is abnormal. And so one of the things that I find fascinating as I, now 20 years into this journey, is recognizing, as I look back, the very first indications that we went after with vagus nerve stimulation were allergies. Then we went after asthma, showed that it worked wonderfully in those areas. I was chased out. It's kind of a funny story. I was at a headache meeting in London and was literally stalked by the chairman of the department at the University College London Royal Free Hospital. He was the chairman of the gastroenterology department, and he wanted to use our device in his patients with gastroparesis, which, when you have mast cell activation syndrome, gastroparesis is a sort of a standard problem that you're going to have because you can't get into digest mode. Food stays where in your gut, and you end up having responses to it, bloating and pains and cramping and vomiting. The other area is eczema. And we've talked about my daughter who was born with infant eczema, and it got worse and worse and worse until she started using a vagus nerve stimulator that we gave her at age 7 and cleared it up probably 75, 80% within 48 hours. So you're absolutely right. The linkage here to the microbiome, the autonomic nervous system, and this mast cell activation hypersensitivity, it's there. There's your triangle right there.
Yeah, exactly. There's a very strong triad that we've found to be linked, these three conditions that are very, very strongly intertwined. And they are mast cell activation syndrome. We've mentioned Ehlers-Danlos syndrome, and POTS, postural orthostatic tachycardia syndrome, POTS. And what that is the experience that when somebody gets up from a laying down state, so when they change their posture, postural, orthostatic literally means that their blood pressure changes take place, and that affects when they move from a laying down to a seated or standing position. Tachycardia is going to take place, and that's going to trigger a decrease in their blood pressure, or their heart rate, tachycardia. And what that's going to do is people feel really dizzy, and they can faint or fall back or essentially lose balance during that period of time.
But it should be differentiated, because it's important, because I experienced this too, because I'm chronically dehydrated from running all the miles that I do. If you're sitting in a chair or lying down and you get up too quickly, you might get a little lightheaded. That's simply a function of a volume function, moving blood that's pooled in your lower extremities, trying to get it up into your head. That's pretty normal. But if in addition, first off, it doesn't clear up and it actually progressively gets worse, and I don't mean progressively worse over years, I'm talking about progressively worse over the seconds, 30 seconds to a minute, it's getting worse. and your heart rate starts to rise. That's the difference. For me, yeah, if I'm lying down, sitting back in a chair watching a movie and I've been sitting there for 2 hours and I jump up, yeah, I might just like, whoa, hold on. Just got to take a second here, get the blood flow up to the brain. That's pretty normal. Lots of people have that. But my heart rate doesn't rise. Give me 5 seconds and I'm back to normal. These people aren't. These people with this it'll get progressively worse. You'll see their faces get white. Their, might even break out in a sweat. Their heart rate is going from, 60 beats a minute to 90 beats a minute to 120 beats a minute to 150 beats a minute. They have to sit down. That's POTS. And it's really associated with, it's one of the primary symptoms of what's referred to as dysautonomia. So to call POTS sort of separate from the autonomic nervous system is, okay, that base of the triangle is a little closer. The dysbiosis is a little farther away, but that's, it all goes together.
Yeah, absolutely. So this is something that my client as well was dealing with, POTS style symptoms upon waking up. She would get up in the morning and it would take her a couple of minutes to get to the point where she could stand up because she was noticing a lack of balance, a lack of mental clarity, an inability to control her cognitive function during that moment. And that was aligned to heart rate changes, specifically due to these postural changes. So these are things that people need to be aware of, right? We need to start looking at the fact that if you've had these dysautonomia style symptoms of POTS, plus you have a little bit of joint flexibility, or you have a little bit of wound healing issues, or you haven't had these things primed, and you're hyperreactive to any minor stressor, it just doesn't seem like an appropriate reaction to the type of stress that you're experiencing or the objective thing that's happening around you, and it's being taken on as though it's a threat to your survival. That is a direct leaning sign towards that bucket is getting full. That person is getting primed. Their immune cells are becoming hypervigilant. These mast cells can activate pretty simply. And so it's just a priming towards that. And so this is what people really need to be looking at from a clinical standpoint as to this is why it's happening. The autonomic nervous system is the key to healing this. No question about it. We need to learn to regulate from sympathetic to parasympathetic. And it takes time for that process to be learned, but it is the key to making sure that these things don't get primed continuously over time. And so in a situation like this, I'm a big fan, and I use this with my client, and I'll share a couple of positive things that have come out so far, that we started using vagus nerve stimulation in her case. And initially, she was not capable of taking on even 2 minutes of the stimulation. In fact, it was even under 1 minute. We were doing 30 seconds to get started for her. We would do cervical vagus nerve stimulation for 30 seconds, or she would do it herself at home. And she would do it right before a meal, making sure that she was getting into her meal state, calm, cool, collected, breathing through as well, priming it with a little bit of humming, doing a lot of vagus nerve activation prior to her meals, prior to her sleep. She had a lot of sleep challenges, waking up 3 or 4 times at night to go to the bathroom. After a couple of months, what we've noticed, and I'm going to pull up the notes that I have from more recent appointments with her, she was always wired and tired, but unable to get to sleep. So she started noticing that she was feeling tired around 9 o'clock, and she would get to bed between 10:30 and 11, and she was able to fall asleep and stay asleep throughout the night. She noticed that her mood was significantly more upbeat. She was not dealing with as many spotlight symptoms, meaning that she wasn't experiencing the immediate sympathetic push when there was a loud sound that occurred. She wasn't getting driven over by something happening, right? Mental fatigue took a lot longer to set in. Her blood flow had gotten better because she had been doing a lot of these things. We started adding a little bit more in terms of food into her diet. So potatoes, carrots, cauliflower. We started adding, in her case, just because she needed a little bit more caloric intake, a little bit of potato chips, because it was a food that she could handle. We tried to get them the beef tallow cooked ones, so they were not the seed oil options. We also added that she was sleeping between 8 and 10 hours per night with 90% no disturbances. She was tracking with an Oura ring, which was great to see. very occasionally waking up to go to the bathroom, but not nearly as much as previously. And she was also then starting to go outdoors for daily sun exposure in the morning and evening. Not during the high UV times in the middle of the day, because that was hyper triggering for her skin, but we did it for the first thing and last thing, morning and evening. And I think that was a really great way to also regulate her circadian biology, get her serotonin, melatonin rhythm back into shape, which was enabling sleep, sensitivities to not be as severe. And that outdoor time, the fresh air, the vitamin D activation, right? The exposure that was taking place there was huge as well. This just amazing symptoms, amazing changes. We added in fish into her diet as well over time, a new protein source. She was able to handle a little bit of salmon, a little bit of freshly cooked food. A big piece when histamines are an issue for a lot of people is stored foods. As food remains stored in the fridge longer, it actually creates more histamine reactivity within those foods. And it is something that can trigger challenges in people that are hyper vigilant. So cooking fresh whole foods for each meal, yes, it can be a pain. Yes, it can be very challenging from a time perspective. But if you can find a way to do it, it can be very powerful in enabling you to get that whole food style diet with the specifically not stored food piece to the puzzle, so that we're not biochemically triggering these histamines as often as possible. The brain fog and anxiety essentially went away in her case, and she in her history had some pretty severe adverse childhood events, pretty severe childhood trauma. She has 3 kids as well, and unfortunately was divorced from her husband. So there was a lot of stress on her, emotional, psychological stress that had primed her into this. But when we started doing these vagus nerve activation exercises, these breathing exercises, this self-regulation tool or this path that we started following for her in an individualized way, we made sure that we started slow, right? Start slow and slow. Note the progressions, note the timeline. It takes time for this to change because your body is so primed and so vigilant that even the change is going to potentially be a trigger to the sympathetic state.
I was just going to say that the fact that she was experiencing some difficulty, even using the stimulator for 2 minutes, suggests to me that she was deep into the vicious cycle of anything that caused her to relax, she was stressed about. Because I mean, just the fact that she couldn't even eat unless she spent significant amount of time relaxing and calming herself puts pressure on that. Now you're feeling and knowing cognitively that there's a threat, that if you can't relax, that's a threat. And so now you're stressing about not stressing.
And if thinking about relaxing is stressful for you, that in itself is a major sign that you're in this sympathetic dominant state, right? That the thought of taking a moment for yourself is going to create this stress. Unfortunate, but very challenging thing for people to go through.
If you find yourself saying to somebody that is either a friend or your spouse, or I can't relax. Okay. If I relax, then the world will fall apart. If you're saying that, you're deeply getting into that zone of that vicious cycle of now you're having a problem getting out of that threat response state. No, I'm sorry. There is simply nobody, unless you're literally in a war and you're going to end up with PTSD. There's no reason why you can't take some time for yourself. You have to, because you're going to become less effective, so that you have to recognize that it's really important. It's really important, but don't stress about it. But you have to recognize it's very important for you not to stress for some period of time, even if it's just 5 minutes. Okay. If you're saying, I can't take 5 minutes for myself, you are deeply in need of 5 minutes to yourself. And you'll become more efficient. You'll become more responsive. It's like that Galloway technique for running that I've talked about on the podcast. Take 5 minutes at the bottom of every hour and just stretch, relax, go to the bathroom, get a bite to eat, call somebody you care about, and just take 5 minutes for yourself. Just breaking up your stresses is so important to your immune system being able to handle it, for your autonomic nervous system and your immune system, and ultimately your metabolism. to be able to deal with it. And 5 minutes, 5 minutes is more than enough time to do 2 minutes of vagus nerve stimulation.
No question about it. That's so huge. From the neuroscience standpoint, if your default is to go into this stress state and to worry about de-stressing, then what that means is it's changed and activated your default mode network, which are the areas in your brain that light up when you're bored, that you're just kind of not active, not doing something. When you are able to sit down for a moment, your default mode network can be pushed into a state where stress and rumination and activation and sympathetic drive are driven from. And that's so huge for a lot of people. And what we're trying to do over time is to slowly but effectively shift from that sympathetic outflow, autonomic outflow, into a parasympathetic primed outflow. That's the way you want to go. And what essentially happens is you actually change the activation of your default mode network, but it takes time for that to occur.
You have to train your brain, because if you're constantly running from one task to the next and you're trying to multitask, that is one of the worst things that people try. Oh, I'm a good multitasker. Well, if you're a good multitasker, then you're a bad immune system. Because what you're doing is you're leaving tasks uncompleted in order to do another task. And we've talked about this. When you switch back and forth between tasks, nobody really multitasks. What they do is they switch back and forth between tasks very rapidly. When you do that and you don't bring one of those to a conclusion, that's very stressful. It activates your sympathetic nervous system very strongly. So multitasking, that's why, people talk about time boxing. My wife is in HR, and one of the tools that they talk about is, well, are you time boxing? Are you saying, okay, I'm going to spend a half hour on this project, and I'm going to spend a half hour on this project, I'm going to have 15 minutes on this project, and their whole day is organized without any breaks for 5 minutes, by the way, but it's whole organized, but they never actually complete the task. Instead of time boxing, you should project box. Okay. In this 2-hour period, I'm going to complete this project. Okay. When you have the next hour, I'm going to complete this task. And when I'm done, I'm not going to move to the next task until I get to the next hour. Okay. And you have to be flexible. If it turns out that one task that you thought was going to take an hour actually takes an hour and a half, don't stress, because chances are the next box that was for an hour, you might get done in a half hour. Just get the thing done. Because, and I've talked to leaders who have said, I never want to touch a piece of paper twice. Okay. If I touch it twice, then I didn't complete it the first time and it's hanging over me. I don't want that. I want to get it done. And that is to downregulate their autonomic nervous system. Because when you're a major executive leader, you've got 100 things you have to do. Just don't leave it as 100 things all day. It's 99, then 98, then 97. Take that bottle of beer off the wall, finish it before you take the next one.
Move on to the next one. We're not promoting drinking too much beer. 100 bottles of beer might be too much for every person here.
Yeah, for most people.
I really love that. I think that's huge. And I think that really links to the neuroscience of success, right? The neuroscience of being able to complete tasks, get it done, move on to the next thing. Every time you finish a task, whether you consciously know it or not, you take a sigh of relief. You go, that's done, and you move off. And that sigh or that exhalation phase is actually a push into that parasympathetic state. And so when you complete it, you can do that. You can create that sigh of relief. You can exhale and let it go. Exactly. And when you don't do it, when you don't complete it, you're holding on to it, and you're holding on and holding on. And that's driving your body into that sympathetic state even more so. I think that is just massive for people that are looking to have greater productivity, greater functionality in their leadership, in their entrepreneurship. Take it, make a decision, and move on. Complete the task and move on. And build in time for those breaks. I love building in time for breaks. You should see my calendar. It's very much in the time blocking phase, but I also block in break time. I make sure that I take time to go outdoors. I make time to go and exercise. I block in those times that are meant for me to downshift or get myself primed to be able to show up and do the entrepreneur thing a little bit more?
There's a very interesting, and let's just say a very interesting fact that needs to sort of play in here. There's an area of your brain called the corpus callosum, and it is the very relatively small number of neurons that connect the two hemispheres of your brain. Okay, so the communication from one hemisphere to the other is happening through this very relatively small number of neurons, hundreds of thousands, not billions. Okay, and one of the things that they found was that for people who had severe epilepsy, if you cut that, you could restrain or constrain the epileptic seizure to only one hemisphere. And that was important because even though one hemisphere would be having a seizure, the other one wouldn't. And as a result, you could break seizures more freely, and they would happen less frequently, and they'd be less severe.
This is called a lobotomy for those who don't know.
Oh, no. This isn't a lobotomy. Lobotomy is actually damaging the frontal. This is
right. Sorry. Yes. It's cutting the corpus callosum. Yeah. Okay.
So the thing that's really fascinating about this is that they found that when you sever the connection between the two hemispheres actually have very different personalities. And they actually have quite different desires. And because they control one side of your body versus another, you could actually have this phenomenal, it's bizarre, but you could actually see people lighting a cigarette with one hand, smoking it, putting it down, and the other hand picks it up and puts it out. Or one hand is buttoning the shirt while the other one is unbuttoning it. And you think to yourself, that person's crazy. Okay, you can call it crazy, but it's just two different hemispheres having two different desires and two different plans. And we have, to a certain degree, every human being has this. So I know for I have a side of me. We talk about it. I have this side of me and this side of me. Well, those sides have to exist in your brain. And sometimes it really is hemispheric. I know that I have a side of my brain that loves being an entrepreneur. And I have another side that likes being an academic. Okay. And those things are pretty different. Okay? Yeah. Now, you can find ways to bring them together, which is good. And I've tried to do that in my life. But when I'm an entrepreneur, I tend to be very interested in the science. And I know that if I spend too much time focused on pure finance or pure other things, that there's a draw away from that to do something that's purely academic. Just dive into research papers and read them because I want to get distracted away. If you don't feed both sides of yourself, if you don't feed both sides, that one side is going to drive stress. You're going to end up with a brainstem, because the brainstem's sort of linked to both sides. It's going to end up with an autonomic response that's a rise in sympathetic activity. So if there's something I'm going to throw this out there. If there's a hobby that you have, if there's something that you love that isn't necessarily where you're making your money, don't shun it. Don't push it away. It's going to lead to a level of stress. It's going to lead to a level of sympathetic activation. Indulge it, not 8 hours a day, but indulge it a little bit so that you can de-stress with it. And we talk about it, like, why does a person, I remember my grandfather had a neighbor who was obsessed with his lawn. He was a banker, but he was obsessed with his lawn. He would literally go out with like tiny little, like almost like cuticle shears and go, cuticle scissors and go out and trim his lawn, all along the hedge. I mean, he was obsessed with it, and you could say that's crazy, but he really took a lot of pride in it, and he enjoyed it. And when you talk to him, he said it relaxed him. So yeah, there was a side of him that was a horticulturalist or a landscaper. I don't know, but you have to give into that so that you don't end up blowing yourself up.
I had a whole chapter in Upgrade Your Vagus Nerve on creative pursuits. Whatever your creative pursuit preference is, individual creative pursuit thing that you want to create. So as simple as a coloring book, right? Like adult coloring books, kids coloring books, very calming effect. Building something, right? Using your hands, being physical, having that motion piece come in. Cuticle shearing your lawn, if that's your thing, that it is. These practices, these moments of experiencing that calming effect. For me, I love biking down to the water and sitting for 5 minutes and breathing while I'm at the water edge and just watching the water flow in and out. And I don't have ocean water, I have lake water, but it's close enough. And I get that calming effect of just being in and around water. And so that's from an exercise / mental health perspective. I do that as much as I can. You have to find that practice that you love, that's creative or that's calming, that helps to get you into that parasympathetic state. And so to bring it back to this mast cell activation syndrome, it truly does come down to autonomic nervous system function, autonomic balance, being able to pull yourself from that sympathetic state back to the parasympathetic rest, digest, and recover state. You cannot regulate an immune system cell when you're stuck in sympathetic state. You need to pull back to parasympathetic to enable that healing regulatory practice to occur. And that is the overarching thought process here. Regardless of the immune activation, inflammatory, histamine specific issues that somebody is experiencing, it comes down to, is your body primed to be in that fight state and threat response state? Is it hypervigilant? Or are you sending signals effectively teaching your body to enter that regulated parasympathetic state on demand? And that is truly the key, because we have control over this, but it has to be trained. And you need to learn how to train that. And then once you do, a lot of these conditions tend to be controlled and often can be completely eliminated for a lot of people. So it takes time. It takes a ton of effort, but there are ways to stop this from really taking over your life. Any final thoughts, JP?
No, I think you said it perfectly. And that is the final message, is that the autonomic nervous system and the immune system are really the same thing. They're all part of the same neuroimmune system that, and frankly, if you want to take the higher conscious, mental health capacity side of it, you're talking about a neuropsychoimmunology. They're all linked together. They're all part of the same system. They don't function independently. They are interdependent, and they are one system. And so when you take the time and the discipline to hack in, the easiest place to do that isn't to take a steroid in order to crush your immune system down, or
an antihistamine to block the histamine reactions,
or anything like that. It's regulate your autonomic nervous system. And when you do that, it's something you need to make a habit. And when you do that, you're going to find that your mast cell activation is less frequent and your symptoms are less intrusive, and that you have better control and over your life, and you'll interact with people better. I mean, I think we all know people that when we interact with them, they just make us more stressed. And then there are other people that you just like to be around because they're relaxing. They're enjoyable to be around. And being that type of person who is relaxed, is easy to be around, is fun to be around, is something that makes your social network stronger. So take the time to try to be in a centered, more relaxed state, not all the time, because we have stresses. And as I said before, I'm not going to make the world any less stressed, or less stressful. What I want to do is make people more resilient to it and more aware of the fact that if they get control of it, they'll have such a better life.
No question about it. I think this has been a really good conversation, a really powerful episode for anybody who is dealing with MCAS or dealing with mast cell activation style conditions or any inflammatory type of chronic health issue. So I highly recommend, if you yourself are suffering, re-listen, go over it again if you need to, or you probably know somebody who's dealing with a chronic inflammatory condition like MCAS. Send this to them. Have them listen to it. Have them understand that there is an autonomic component and there truly is hope to make these changes take place so that they can live an upgraded life and have upgraded health. So share this episode with that 1, 2, or 3 people who you think could use this information to upgrade their health. And we'll catch you all on the next one.